Hello, everybody, and welcome to the next episode of the Practice Pulse podcast. I have the pleasure today of having with me a dear friend, Miss Katie Wienecke, and she is the current director of partner relations for Dental Lifeline Network, also known as DLN. Welcome, Katie.
Thank you. I am so delighted to be here.
So let's talk about a little bit about who Katie is and what she does for DLN, right?
Uh,
Katie works to build.
My favorite subject. Um, so Dental Lifeline Network is a nonprofit that's celebrating its 50th year in operation. And our main goal is to connect some of our marginalized adult populations with volunteer dentists and labs who will help them receive the critical dental care that they need. So we really focus on patients who are over 65, medically fragile, or living with a disability that can't otherwise afford this care. And so within that work, I focus on our partner relationship. So I am really primarily focused on building partnerships with our DSOs, our group practices, any of our dental offices that sort of have kind of a bigger scope than 1 to 2 offices, because we just recognized about 2 years ago there's almost a different need there than working with individual offices. So we really try to help coordinate marketing with them, really helping with storytelling, really helping with recruiting. And so my job is to try to find those group practices and DSOs that are looking to make an impact, want to do, more for their communities, do right by their communities, and don't know how to do it. And so we have this very easy program to participate in called Donated Dental Services, where we really, much like a DSO, tries to take care of a lot of the behind the scenes so dentists can just do their dental work. We try to do something very similar with volunteer work. So, we coordinate we do all the patient screening. We coordinate getting them to the office, getting them scheduled, and then we stay with them from start to finish so that the dentist can really just focus on doing their dental work by giving back with this patient.
That's amazing. That's such an amazing job to have. And I feel like you are in a really blessed position to be able to do such a huge benefit for the community, as well as from taking the administrative task off the dentist's shoulders so that they can focus on just taking care of the patients. I mean, that is a true blessing both for the dentist as well as the community, because I know there are a lot of dentists out there who want to do community outreach and just don't know how to go about it, or are, even if they know how to go about it, they're concerned about all the paperwork, so to speak, that it would involve trying to do something like this. So this is wonderful that you are able to create this sort of area where the dentist can do the work unencumbered by paperwork, so to
Yeah,
speak.
you'll hear us say this, like if you talk to anyone from Dental Lifeline Network, we're always like, we just want to make it easy. We just want to make volunteering and giving back easy because we understand how much work our dentists are doing on a day-to-day basis and what it does take to see, a patient from start to finish with a treatment plan. And so we want to make that as easy as possible, doing as much of that as we can. And then same thing with group practices. We understand, and DSOs, we understand there's a lot going on there. There's a lot that they're doing, and they're often hesitant to add pieces to their dentist workload or to their other staff's work. And so we really try to take as much off of them and put it on us as we can.
That's awesome. Now, are there like certain DSOs or DP group practices that you
Yeah.
guys work with? Or is it anything or anybody, or they have to take in a certain kind of insurance? I guess I'm asking multiple questions in one.
So, yeah, no, but really great questions. So we work with anyone who wants to donate their time. So, because it's all donated. Ours is a network. We call on dentists that are willing to do the work 100% donation. And we do have labs and specialists. So we will work with our dentists once they create a treatment plan to make sure if they need that lab work or if they need specialists, that it's not on them to find that or get that donated. We work with our other partners in our labs to make that happen. And we operate programs in all 50 states. So we're everywhere.
That's awesome. So that's great to know that you are nationwide, and so it's not just, you know, area specific or state specific. So that's really great. So can you share with us your journey in becoming the director of partner relations at DLN, and really what drew you to dental?
Well, absolutely. So I've been in nonprofit, I pretty much my whole career. Before this, it was predominantly working with foundations and education. So kind of different, but kind of the same. What I did on my last role was building corporate partnerships with a public school district. So really finding the people in a company that were saying, hey, we want to get our teams to volunteer, or we want to find a meaningful way to invest in your nonprofit, whether that's through financial gifts, or whether that's through donated items, or whether that's through our time. So we call it time, talent, and treasure, and really helping people create these partnerships, whether it was directly with the district or with individual schools or around a program, like sometimes specifically around STEM or specifically around coding. But whatever, we really wanted to find ways to kind of make their hearts sing with the way that they were giving back in their communities. And then, I felt like it was really fun, and I wanted something a little more challenging. And this role came open. And within Denver, our CEO, Linda Rickinson, is really pretty well known and very respected. My supervisor, Holly Stevenson, also pretty well known and great. So an exciting opportunity to work with some pretty phenomenal nonprofit people, but really it was a brand new role. And so it was this opportunity to kind of build and create and design a strategy and partnerships in the same way of figuring out, what do group practices need? What do they want? How do we help them connect in a way that makes them happy and satisfied with the partnership with us? So that's how I came to DLN, and it's really been a lot of fun. I think, people like Rebecca who are so welcoming. I met her, I think, in my first conference, and she just is like warm and friendly and excited to see her at other places. And I feel like other people are like that. And then, I feel lucky because I get to work with the people in dental who do have that kind of calling in their heart that they want to give back, that they want to see their company be more than just about EBITDA and bottom line. They want to be part of something bigger and better in their communities. And it's really special to get to work with those people.
That's so awesome. That's so awesome. And that's amazing that you made that shift from education to dental just to, create something in DLN which didn't exist before so that you could spread the word, spread the message, and help, really do the communities a larger service because of creating something like this, because I guess it is sorely needed, and definitely bringing the expertise from education, because education is a tried and tested behemoth. And
That is true.
bringing that little piece into dental, which is, we're generally many times overlooked because, it isn't medical. It's an allied health science, not considered mainstream yet, which is kind of unfortunate. But, the fact is that, of course, we are getting more and more mainstream slowly, but it's a slow road. And the fact that you recognize that and were like, okay, I'm going to take this opportunity and create something and move into uh, this changing world of
Yeah.
dental.
It is a challenging field to be a part of, and kind of a wild ride, but just fun. People are so nice. I'm sure everybody says that, but I feel like either I've gotten very lucky, and all the people that I get to interact with are so kind. But it's a neat field, and I do think it's really interesting, when to follow and learn more about how it is, this movement to try to make it more mainstream health. I think is just phenomenal and so important, because oral health is everything.
Right. Yeah. And I think that's the thing, that we didn't have that kind of recognition till really now, that people are starting to understand that oral health, it's the gateway, right? It is now said, we label it as oral systemic health. And before, it was not joined together. It was either oral health or it was systemic health, but there was no connection. And now, though, with improving science and changes in even just the CT scanning and understanding how airway is one of the, what do you call it, the main reasons people have so many health issues later on. And, all these connections were are recent, they're very, very recent. All these findings, all these understandings, they're definitely, changing the scope of oral healthcare as we see it. And I'm delighted to be a witness of it, of the whole change. And, it's great to have partners like you, like I said, who are invested in moving the needle forward. So,
Yeah, and I think it's really interesting, because you know I wish everybody could see what we see, because we definitely see patients who also were not informed about how important their oral health care was. And so a lot of times the work that our dentists are doing on their mouths are just a piece of the puzzle, but they're such an essential piece, because they can't get the rest of the care that they need until their mouth is in working order. I mean, it's just, yeah, it's just so important. Oral health is just so important.
right. No, absolutely. So, in your role at DLN, how do you go about building and maintaining these partnerships, also with the DSOs and group practices? Oh my gosh, I can just imagine that's a lot of work. What is your secret sauce?
Oh, I I think the biggest piece for us is we're really open to ideas. And it's really important to us to understand, especially with DSOs, DPOs, all of them, you know, what is it that they need from us to be successful in implementing this, and where can we do that lifting for them? And then what are the needs in their community, and how do we help them reach their community? And, and being accessible. Those, I think, are all pieces. I mean, our groups try really hard, and we're part of a million moving pieces in their organization. And so we just try to be really consistent and really patient, and celebrate the successes that they do have very publicly, so that they too get to see and celebrate the work that their dentists and their partners are doing. Because it's one thing to say, like, oh, this is a really great program and they're helping people. It's it's another thing. It's a much bigger thing when we can say, your Dr. XYZ saw a recent case. We had a grandfather whose grandchildren were afraid of him and would not spend any time with him. This was part of what we learned on the intake, and a big motivator for him to get his oral health, um, because his grandchildren wouldn't visit him. And I just thought, could you imagine? I mean, every time with our patient stories, I think, could you imagine? And so these dentists that donated, the specialist in the lab that helped him get his dentures and get his smile back, when he wrote at the conclusion of the case, now I can spend time with my grandchildren and they aren't afraid of me. The impact that you've just made as a dentist, as an organization, on a person's life, is immeasurable. And in your culture, like this is something you as an organization are supporting and encouraging your staff to participate in. When we can help them see that story and that piece, it goes so much further in helping them create the culture that they're looking for and in doing the work that they need. So I think that's a big part, is really helping bring home the work that they're doing from the dentists who are doing it and seeing it directly to oftentimes, the C-suite who are not as directly involved.
No, that's so important and so cool to be able to attach a story like that and really showcase that we are changing lives. It does make a difference. We are making an impact. And it's important for team members to see that too, because it's not just the dentist, because we don't work alone. We don't practice in isolation. We have our whole team that is always working with us to give people the care that we can give to the best of our abilities. And so it's really awesome that you guys showcase that, because that's important. It's important. Not only is the science important, the emotions are important too, because only emotions science can only go so far, but emotions can carry you much further.
Right. I think like we just like embarked on this whole kind of storytelling uh marketing campaign, and a big piece of it was really talking to dentists and being like, what are we missing, or like what is motivating you? Why do you do this with our volunteers? And we just hear over and over again, not with the volunteer work, but why they got into dentistry is to help,
Yeah.
period. And, this is, I think, an opportunity for them to see such a big help, a big impact. You're helping every day by helping
Mhm.
people keep their teeth, be able to eat, being able to stay healthy, being able to smile, being able to get the jobs that they're looking for. I mean, the amount of biasy that goes into people's smiles and the judgments that get made based on what people's teeth look like,
Mhm.
and every day it was dentists and your staff as support and are all helping to make that happen. And so it is really, I think, almost more important that you're hearing the story of the impact that you're making and getting reminded that the work that you were doing can change. It literally changes lives. Every day
Right.
you are changing lives by the good work that you are doing.
That's so great. I mean, hearing this now, I want to know if you guys have any opportunities for private practices.
You better believe it, lady. We will take you in a heartbeat. No, I would tell you, I'm one piece of the puzzle. We have a really great team. We have about 30 coordinators that work, 32 coordinators that work with all of our states, screening the cases, getting them connected with dentists. And we have our national staff where we work on all of our individual volunteers. We want to be providing that same level of partnership and stewardship to our individual volunteers too. So we have other staff dedicated to that as well. We have a wait list of about 5,000 patients right now. So our need is always there. We love anyone who wants to give their time.
Awesome, awesome. And so, how does someone get involved with DLN, and what kind of commitment? What are we looking at?
Well, it's so easy. As I've mentioned before, easy is the name of the game for us. So you can always email any of our national staff directly if you're interested. There's a place to sign up on our website. And really, we just need your name and information to do the I want to volunteer click. And we run the check, we send you a welcome letter, and our ask is one patient a year.
Mhm.
So, and it's you really, as a dentist, as a volunteer, have a lot of say in that. So once we screened a patient that looks like they're in a region and fit with any parameters you've given us ahead of time, we'll send you the patient profile. And you have the opportunity when you look at the patient profile to say, not at this time, or not right now, not we don't have the capacity. But if you do take it, they go in for an initial consultation, and that's where you can really see what is the actual flow of this treatment plan. And you have the opportunity at that point again to say, I'm sorry, we don't have capacity right now. Can you find another dentist? But if you do take them on, like I said before, we'll work with you every step of the way to make sure that that patient is showing up, to make sure that they are accepting and grateful of the treatment plan that you give them, and then making sure that we get everything you need donated, whether that's lab, whether that's specialist work. We'll work with you. And that's it.
Wow, that's amazing. That's amazing. So what is that website, if you could mind sharing with the listeners here?
Absolutely.
Mm,
Sorry. I
mm,
always forget. It's just www.dentallifeline.org.
.org.
Mm-hmm.
Okay,
Yep, we're a
that's
nonprofit.
that's great. And then anybody and just they can click on, well, I
Oh,
want to
it's
volunteer.
all over our website. Volunteer here. Sign up to volunteer here. And then I think I've submitted my contact information. They can always reach out directly to me. We are always so excited for more volunteers and support.
Awesome. Now, this is only for dentists or dentists and dental hygienists. Are you only looking for clinical providers at this point? Am I correct?
Yeah, we do love hygienists. I do have to say we love hygienists and we love using them as a resource. Our database is dentists. So
Okay.
both. We take
Okay.
both. We love
Okay.
both. Yeah, I
Yeah.
would say both.
Okay, sounds good. Sounds good. That's so awesome. Well, you guys are doing a fantastic job, and one patient a year is really not a huge commitment. And for the, like I said, for the feeling of getting things done right, and also giving the chance, as you said, for community outreach, I think most dentists should, and I know a lot of dentists would love to avail this opportunity, and a lot of dentists don't know about this. So this would be great, and I would be happy to put it out there because this
Thank
is
you. Thank you so much.
absolutely, because there I have a lot of different networks that I'm a part of, and I'm sure, we're always looking for ways to donate either our expertise or our time, and what a better way than community outreach. So, and the best part is we can just do teeth. So that's
Exactly right. You can change a life. That is the best part. By just doing what you are talented at, what you are the expert in, I guarantee you will not just change the person's life that you see, but you will change their family and friends' lives as well. I mean, think about those grandkids.
yeah,
Could you imagine being afraid of your grandparents just based on the way that they look and missing out on that relationship? And that dentist gave that family back, their grandparents. It's
yeah.
pretty amazing what you guys can do.
It is amazing to be able to give people their smile back, their chewing function back, and basically their entry to society back. So
Yeah,
it
exactly.
it is a true blessing to be a dental professional, and it is wonderful. It's a bigger blessing for me to have been connected with you and see what DLN and hear all about what you guys are doing, because it's simply powerful. So thank you.
Well,
Thank you
thank
for
you
doing what
so
you do.
much for having us on here.
Absolutely. Absolutely. The pleasure was all mine. And I will definitely reach out to my networks as well and spread the word for DLN, because you guys are doing great things. And I hope to see you, rise and grow in the future. And then you can be like, we got you, Doc.
We got you, dog. It all started here on Practice by Numbers.
Well, thank you so much, Katie. Thank you for taking the time and telling us about DLN, and look forward to partnering with you in the future.
Thank you. Us too. Thank you so much for having me.
Absolutely.